Greetings, my name is Larry Stack. Along with my colleague Jason Williams, in the next 8 minutes and 33 seconds, we will discuss the evaluation of eye disorders. Learning objectives include: describe common eye complaints that prompt patients to seek medical care. Develop a differential diagnosis for the following complaints: acute visual disturbance, red eye pain, eye discharge, foreign body sensation, eye injury. Demonstrate the ability to correctly obtain and communicate the 5 vital signs of the eye: visual acuity, interocular pressure, pupillary response, visual field testing, extraocular movement testing. Describe the typical symptoms and examination findings of each of the differential diagnoses of common ocular conditions listed above. Eye complaints that prompt patients to seek medical care include the following: eye pain, visual disturbance, red eye discharge, foreign body sensation, eye injury. That may have been a little fast, so let's do it again, but this time in Spanish.
Dolor de ojo, trastornos visuales, ojo rojo, secreción ocular, sensación de cuerpo extraño, lesión ocular.
Let's start with a case of eye pain. A 62-year-old female with hyperopia complains of sudden onset right eye pain immediately after seeing Top Gun Maverick in an IMAX theater. Exam reveals normal vital signs. Visual acuity is 2400 in the right eye and 2030 in the left eye. Pupils, right eye 5 millimeters and fixed and non-reactive. Left eye 3 millimeters round and reactive to light. Interocular pressure is 56 millimeters of mercury in the right eye and 17 millimeters of mercury in the left eye. Extraocular movements are normal with no evidence of entrapment. Visual field is diminished in the right eye and normal in the left eye. What is the differential diagnosis of acute eye pain? This is not a rhetorical question. Take 30 seconds and write down all of the conditions that cause eye pain that you can think of. Pause the video while you write them down. This patient has acute angle closure glaucoma, which is defined as a rapid elevation of intraocular pressure due to abrupt closure of the anterior chamber angle, with potential for irreversible vision loss if not treated immediately. A corneal abrasion is defined as a superficial scratch or scrape of the corneal epithelium. This patient has a corneal foreign body, which is defined as an object, frequently metal, embedded on or in the cornea. The foreign body seen here is metallic. This patient has a corneal ulcer, which is defined as a microbial infection causing corneal tissue loss. Corneal ulcers are frequently attributed to extended wear contact lens use. Herpes simplex keratitis is a corneal infection caused by herpes simplex virus reactivation. Uveitis, also called iritis, is defined as inflammation of the uvea, which includes the iris, ciliary body, and the choroid. Optic neuritis is defined as acute inflammation of the optic nerve causing painful visual loss. Endophthalmitis is a vision-threatening infection and inflammation of the internal structures of the globe. Chemical injury is defined as damage to the eye tissues, typically the cornea and conjunctiva, from chemical agent exposure. This is a review of the conditions which might cause acute eye pain. This is not an exhaustive list, but covers 95% of the causes of acute eye pain. Let's do a case of visual disturbance. A 22-year-old male college basketball player complains of sudden onset of painless visual field defect, like a curtain coming down over the lateral peripheral vision of his left eye. Exam reveals normal vital signs: visual acuity 20/20 right eye, 2200 left eye. Pupils 4 millimeters bilateral round and reactive to light. Interocular pressure 16 millimeters of mercury right eye, 13 millimeters of mercury left eye. Extraocular movements are normal, no entrapment. Visual fields diminished in the left eye, normal in the right eye. Ocular POCUS reveals the findings seen here in the photograph. What is the differential diagnosis of acute visual disturbance? Again, this is not a rhetorical question. Take 30 seconds and write down all of the conditions that cause acute visual disturbance that you can think of. Pause the video while you write them down. This patient has an acute retinal detachment, which is defined as a separation of the neurosensory retina from the underlying retinal pigment epithelium. An ocular migraine is a transient visual disturbance with or without an accompanying headache. posterior vitreous detachment is a separation of the posterior vitreous cortex from the retina. This is a pictorial explanation of a posterior vitreous detachment with retinal tear, and a posterior vitreous detachment retinal tear with a retinal detachment. Amaurosis fugax, which is a transient ischemic attack of the eye, causes transient monocular blindness from temporary reduction of blood flow to the retina, most commonly due to emboli from atherosclerotic carotid artery disease. Corneal disease or irritation, such as a pterygium seen here, which is a wing-shaped conjunctival growth extending onto the cornea due to chronic ultraviolet light exposure. A vitreous hemorrhage is bleeding in the vitreous cavity of the eye, most commonly due to proliferative diabetic retinopathy. These images demonstrate POCUS findings of a retinal detachment, vitreous detachment, and vitreous hemorrhage. Optic neuritis is an acute inflammation of the optic nerve, causing monocular, painful visual loss. Central retinal vein occlusion is a blockage of the central retinal vein, causing visual loss due to retinal ischemia, macular edema, from blockage of venous outflow. Branch retinal artery occlusion is defined as the blockage of a retinal arterial branch causing retinal ischemia and typically a monocular visual field deficit. This is a review of the conditions that might cause acute visual disturbance. This is not an exhaustive list, but covers 95% of the causes of acute visual disturbance. Let's do a case of a red eye. A 37-year-old male pediatric emergency physician reports bilateral eye redness, stringy discharge, and eye fullness. Exam reveals normal vital signs. Visual acuity is 20/20 right eye, 20/20 left eye. Pupils are 4 millimeters, bilateral, round, and reactive to light. Interocular pressure is 12 millimeters of mercury, right eye, 10 millimeters of mercury, left eye. Extraocular movements are normal, no evidence of entrapment. Visual fields are normal. What is the differential diagnosis of the acute red eye? Again, this is not a rhetorical question. Take 30 seconds and write down all the conditions that cause a red eye that you can think of. Pause the video while you write them down. Conjunctivitis is an inflammation of the conjunctiva which causes redness, discharge, irritation, foreign body sensation, and tearing. Uveitis, also called iritis, is defined as inflammation of the uvea, which is the iris, ciliary body, and the choroid, and causes a red eye, photophobia, and pain. Subconjunctival hemorrhage is bleeding, commonly traumatic, under the conjunctiva, causing a sharply demarcated area of redness of the eye. Ahyphema is defined as blood in the anterior chamber of the eye, which originates from an iris vessel, most commonly from trauma. Acute closure glaucoma is a rapid elevation of intraocular pressure due to abrupt closure of the anterior chamber angle with potential for irreversible vision loss. Endophthalmitis is a vision-threatening infection and inflammation of the internal structures of the globe. Blepharitis is defined as inflammation of the eyelid margins causing redness, irritation, and greasy crusts. Dry eye syndrome is defined as decreased tear production causing eye dryness, irritation, redness, and blurry vision. Episcleritis is defined as inflammation of the episcleral tissues causing eye redness and mild discomfort. A corneal abrasion is defined as a superficial scratch or scrape of the corneal epithelium. This is a review of the conditions which might cause the acute red eye. This is not an exhaustive list, but covers about 95% of the causes of the acute red eye. Let's do a case of eye discharge. A 57-year-old male reports clear discharge from both eyes and severe pruritus after getting off a plane on his first visit to Nashville. Exam reveals normal vital signs. Visual acuity is 20/20 right eye and 20/20 left eye. Pupils are 4 millimeters bilaterally, round and reactive to light. Interocular pressure, 14 millimeters in the right eye and 15 millimeters of mercury in the left eye. Extraocular movements are normal. There's no evidence of entrapment. Visual fields are normal. What is the differential diagnosis of eye discharge? Again, this is not a rhetorical question. Take 30 seconds and write down all the conditions that cause eye discharge that you can think of. Pause the video while you write them down. Allergic conjunctivitis is defined as inflammation of the conjunctiva from allergens causing itching, redness, tearing, and swelling. Viral conjunctivitis is defined as conjunctival inflammation from viral infection causing redness, watery discharge, irritation, and discomfort. Bacterial conjunctivitis is defined as a conjunctival infection caused by bacteria, which results in redness, purulent discharge, irritation, and eyelid sticking and swelling. Gonococcal or hyperacute conjunctivitis is defined as a severe, rapidly progressing conjunctivitis with copious purulent discharge due to gonococcal infection. Nasolacrimal duct obstruction is defined as an obstruction of the nasolacrimal duct impairing tear drainage from the lacrimal sac to the nasal cavity, resulting in clear or white ocular discharge. Dacryocystitis is defined as infection and inflammation of the lacrimal sac secondary to nasolacrimal duct obstruction. Dacryoadenitis is defined as inflammation of the lacrimal gland characterized by erythema, tenderness, and superiolateral eyelid swelling with purulent discharge. This is a review of the conditions which might cause acute eye discharge. This is not an exhaustive list, but it covers approximately 95% of the causes of acute eye discharge. Let's do a case of foreign body sensation of the eye. A 37-year-old male mechanic reports worsening left eye foreign body sensation for the past 36 hours. No ocular history or use of corrective lenses. Exam reveals normal vital signs. Visual acuity is 20/20 right eye, 20/70 left eye. Pupils are 4 millimeters bilaterally round and reactive to light. Interocular pressure is 16 millimeters of mercury right eye and 13 millimeters of mercury left eye. Extraocular movements are normal, no evidence of entrapment, visual fields are normal. What is the differential diagnosis of eye foreign body sensation? Again, this is not a rhetorical question. Take 30 seconds and write down all the conditions that cause ocular foreign body sensation that you can think of. Pause the video while you write them down. A corneal foreign body is defined as the deposition of exogenous material on or within corneal layers causing localized inflammation. An eyelid foreign body is defined as the lodgement of exogenous material in the eyelid margin or tarsal conjunctival surface causing inflammation and irritation. A corneal abrasion is defined as a superficial epithelial defect of the cornea resulting from mechanical trauma or friction. A pterygium is defined as a benign fibrovascular conjunctival growth extending onto the cornea due to chronic ultraviolet exposure, typically from the medial side. A pinguecula is defined as a yellow-white conjunctival nodule near the limbus caused by ultraviolet-induced elastotic degeneration. Conjunctivitis, viral in this case, is defined as a contagious inflammation of the conjunctiva caused by adenovirus, most commonly with watery discharge and redness. A chalazion is defined as a chronic granulomatous inflammation of a meibomian gland causing an eyelid nodule. Ultraviolet keratitis is defined as corneal epithelial injury from ultraviolet light exposure causing pain, photophobia, tearing. Contact lens keratitis is defined as corneal inflammation due to hypoxia and mechanical irritation due to contact lens use and overuse. A hordeolum or stye is defined as an acute localized infection of an eyelid gland presenting as a painful red swollen pustule. This is a review of the conditions which might cause an ocular foreign body sensation. This is not an exhaustive list, but it covers 95% of the causes of acute ocular foreign body sensation. Let's do a case of eye trauma. A 37-year-old male was struck with an unknown weapon to the left eye. He complains of pain and decreased vision. No ocular history or corrective lens use. Exam reveals normal vital signs. Visual acuity is 20/20 right eye. Light perception only of the left eye. Right pupil is 4 millimeters round and reactive to light. Left pupil is peaked. Interocular pressure is 16 millimeters of mercury in the right eye. Because of their suspicion of an open globe, pressure was not checked in the left eye. Extraocular movements are painful. Visual fields are diminished in the left eye, but normal in the right eye. What is the differential diagnosis of eye trauma? Again, this is not a rhetorical question. Take 30 seconds and write down all the conditions caused by eye trauma that you can think of. Pause the video while you write them down. An open globe is defined as a full-thickness corneal or scleral injury with external communication of intraocular contents. and is considered an ocular emergency. A subconjunctival hemorrhage is defined as an extravasation of blood beneath the bulbar conjunctiva, forming a localized, well-demarcated red patch. A hyphema is defined as an accumulation of blood in the anterior chamber, typically traumatic, causing pain, photophobia, and vision reduction. A corneal abrasion is defined as a superficial traumatic epithelial defect of the cornea, causing pain, photophobia, tearing, foreign body sensation, and blurred vision. A chemical injury is defined as an ocular surface or deeper injury from acids, alkalis, or irritants causing pain, epithelial destruction, and edema. An eyelid laceration is defined as a partial or full thickness eyelid injury which may involve the lid margin, canaliculus, levator, globe, and tarsal plate. Circumferential hemorrhagic conjunctival chemosis suggests retrobulbar hemorrhage and open globe injury risk. An orbital blowout fracture is defined as a fracture of the orbital floor or medial wall, causing entrapment, enophthalmos, diplopia, and hyposthesias. This is a review of the conditions which might occur after eye trauma. This is not an exhaustive list, but covers 95% of the conditions seen in an acute eye trauma. So what next, you ask? Learn the common signs and symptoms of each of the diagnoses presented in this discussion. Be prepared to test your knowledge acquisition in an active learning activity, specifically a Jeopardy game. The prizes for the winners will be beyond